Hi there, I'm Dr. Leslie Masters from Masters MD. Today I want to talk to you a little bit about something we call metabolic medicine. You know, science is discovering what the ancient healing traditions have always known, that every person is unique. And the more detailed our understanding is of the whole person, the better able we are to detect and correct imbalances that cause aging and disease. You know, this is the new medicine, and this is what we call metabolic medicine. If you don't look good, you don't feel good. But if you don't feel good, you don't look good. We all want both, and we all deserve both. And that's a little bit of what metabolic medicine is about. What metabolic medicine is not is this. It is not medicine for the masses. We know that just doesn't work. Right now, if you look at the top 4 killers of people in the United States, heart disease, cancer, stroke, number 4 is adverse drug reactions, adverse reactions to pharmaceutical drugs. And I think that's astounding. Medicine for the masses doesn't work. It's wonderful. Traditional medicine is wonderful if we need it. But so many of us don't need it, and a prescription drug is not the answer. Metabolic medicine is going to focus on keeping us healthy. Right now we're set up so we can go to our doctors. Our health insurance will pay for it, but we have to be sick before we go. So I'll go to my doctor. He'll say, oh, you've got diabetes. Give me a prescription, and off I go with a new diagnosis. Well, where was my doctor before I got diabetes, before I got sick? That's what metabolic medicine focuses on. How can we stay healthy, stay vital, feel good for a long period of time, and stay away from prescription medicines and things that may cause us harm in the long run? Metabolic medicine is really about balance, body, mind, spirit. You hear a lot of it, but the truth is, so many of our problems that are out there today are stress, anxiety, depression, sleeplessness, and we can remedy those problems naturally, with lifestyle, with nutraceuticals, or we can let them mount up and cause us physical problems and disease. I'm going to talk more about various areas of metabolic medicine coming up.
Well, prior to meeting Dr. Masters, I'd spent about 8 months suffering with anxiety attacks, waking up in the middle of them, not sleeping 2 to 3 hours a night. I'm an ICU nurse, and I was very lethargic. I had to be on top of my game. I knew there was an issue. Spent a lot of time with other doctors trying to find out why I was suffering with anxiety, because I'm not big on pharmaceuticals, even though that is what I deal with every day. I want a different route. And so I heard about her seminars, and I came to listen to one of her seminars here in our office, and I was really intrigued by this metabolic mapping. Being in the medical field, I know that when you're metabolically off, there's a lot of things can go wrong, and everything that was pointing to my symptoms was hormone issues, and so we just thought that was going to be what it was. So I went ahead and let her test me. I went for the full testing of saliva, urine, blood, and when the results came back, we were completely dumbfounded that it was not the issue that we thought it was going to be. It was not hormones, it was not cortisol, it was amino acids, it was my magnesium, and just the little changes we did with my diet and her getting me some compound nutrition just for me made such a difference. I'm sleeping again. I have absolutely no more anxiety. I no longer take Xanax. I no longer take antidepressants. So it has totally, completely changed my entire way of living. I'm no longer wanting to sleep 12 hours on my day off because I don't have any energy. It just totally changed everything she did for me. I mean, I just feel so much better. I would highly recommend Dr. Masters procedures, especially if you're dealing with anything physical and you can't quite put your finger on what's going on. You've been to a slew of doctors, they can't find out what's going on. The metabolic mapping will truly decipher what is going on in your body from the top of your head to the tip of your toes. And I have a lot of friends that I have recommended them come in. They're having different issues, but keep telling them that if you want to find out what's going on and you want to be at your optimal health, this is the best thing to do. And you do not have to do the big testing that I had done. You can start smaller and they'll still be able to find out. I just had been struggling for so long, that's why I chose to go and get it all done. And it's the best. I think we have to be proactive in our own health. A doctor can only do so much, and we have to take care of ourselves.